Roland Van Kimmenade and Mike Gibson coming to you live from ACC 2025, and we're talking about liberal versus restricted fluid intake and chronic heart failure. Roland, talk to us a little bit about what you did and what you found.
Yeah, well, thanks, Mike, and thanks for having us. Well, we performed a study called the FRESH-UP study, studying the effects of liberal fluid intake versus fluid restriction in chronic heart failure patients. So we randomized 504 patients to a liberal fluid intake regimen or a restrictive regimen of 1,500 milliliters of fluid intake. And our primary endpoint was quality of life as assessed by the Kansas City questionnaire.
And what did you find?
So after 3 months, we found a difference in Kansas City questionnaire of 2.17, which is a clinically relevant difference, but it was not significant, a p-value of 0.056. So that's frustrating, of course, but well, it
Just
shows that
a drop of water away from significance.
Yeah. But nevertheless, I mean, that was our primary endpoint. We also had safety endpoints, etc. And we looked at heart failure events, mortality, kidney deterioration, NT-proBNP levels, body weight increase, etc. And none of those secondary endpoints differed. So I think that's important. And our key secondary endpoint was the third distress scale, which you may not be familiar with, but showed that patients with fluid restriction indeed suffered more from thirst. So I think that our study questions for the first time really the significance or the effects of fluid restriction in chronic heart failure.
And when you talk about the KCC quality of life, did it go in favor of restriction or against it?
It was in favor of liberal fluid intake.
More in favor.
Yeah.
Yes.
Yeah.
All right. Well, you ask an honest question, you get an honest answer. Are you going to follow this up with anything, or is this all that you're going to do with this?
So we have some interesting sub-analysis coming up, which we will report later on this year. But I think it's a fascinating field, especially if you look at heart failure. We're studying a lot of very highly sophisticated stuff like new devices for LVADs, gene therapy, etc. But the effects of fluid restriction has never been studied in this way. So I think it's, as adequately pointed out in the guidelines, it's a gap of evidence. And I think we're proud that we're trying to set the first steps in this field. And I think that we have shown that in chronic heart failure, the benefit of fluid restriction is not important. So I think that this is a very important clinical message.
Well, we want to make sure we are adding years to people's lives, but we also want to make sure we're adding life to those years. So thanks for looking at this so closely in the first real way. Thanks for sharing with us today, Roland. And thanks to all of you for joining us here live from ACC 2025.
Thank you very much, Mike.